Have you ever found yourself wondering about a subtle shift in your usual breathing patterns, or perhaps a familiar symptom suddenly feeling much more intense? When you are living with chronic obstructive pulmonary disease, or COPD, becoming keenly aware of these changes is one of the most proactive and powerful steps you can take for your health. So, to directly address the question, should you be concerned about a sudden increase in coughing with COPD? The answer is a clear and resounding yes. This particular change is a significant signal that your COPD might be experiencing a flare-up, also known as an exacerbation. It is a key symptom that warrants your immediate attention and further assessment. Let us dive into the why behind this concern. A cough is your body's natural defense mechanism, designed to expel irritants or excess mucus from your airways. However, in COPD, your bronchial tubes are already compromised, often inflamed and narrowed. A sudden, persistent increase in coughing, especially if it is more forceful or productive than usual, can indicate a range of issues. These include heightened inflammation within the airways, a new respiratory infection taking hold, or an increase in mucus production that your lungs are struggling to clear. All these scenarios place additional stress on your respiratory system, potentially worsening your breathing capacity and leading to more severe symptoms if not addressed early. When you notice this concerning change in your cough, acting swiftly and purposefully is paramount. Your very first step should be to consult your personalized COPD action plan. This vital document, developed with your healthcare provider, outlines specific steps for managing worsening symptoms, including when to adjust medications or when to seek medical help. Simultaneously, start observing other symptoms. Are you producing more sputum, and importantly, has its color, thickness, or amount changed? Are you experiencing increased shortness of breath, making simple activities like walking across a room feel much harder? Look out for new or louder wheezing, chest tightness, or even a low-grade fever. These accompanying details are incredibly valuable for your doctor and will help them accurately assess your situation. Here is an insider tip to help you distinguish between your everyday COPD cough and one that signals a potential flare-up. While a regular cough is a common part of living with COPD, a troublesome cough is often characterized by a noticeable increase in frequency and intensity. It might feel deeper or more exhausting, and it could be accompanied by a change in your mucus, perhaps turning yellow, green, or even bloody. You might also find that your usual bronchodilator inhaler is not providing as much relief as it normally does. Keeping a simple symptom diary or a note on your phone can be a game changer. Jot down the time, intensity, and any associated symptoms, which provides concrete information for your medical appointments. Ultimately, recognizing and promptly responding to warning signs like a sudden increase in coughing is fundamental to effectively managing COPD by diligently following your COPD action plan and communicating openly with your healthcare team. You are taking powerful steps to intercept a potential flare-up before it fully escalates. This proactive approach helps protect your precious lung function, minimizes discomfort, and significantly enhances your overall well-being. Your active participation in managing your condition is truly the cornerstone of a healthier life with COPD.